South Africa has, for the 5th day in a row, recorded more than 1,000 daily coronavirus infections. Since the last report, the number of cases has increased by more than 300. 29 more people have also succumbed to the virus, and that brings the death toll in the country to 52,111. Now, our reporter, Hitekani Magwedze, is in studio to unpack just some of the issues around the pandemic. Welcome. Great to have you with us.
Great to be here
on this public holiday. So let's begin, I think, with an issue that is at top of mind for all of us, and that's the issue of the vaccine rollout campaign. You know, the experts tell us that we are doing very, very well, but the numbers tell a different story.
Unfortunately, the numbers do tell a different story. I mean, by Saturday, we're averaging about 1,400 COVID-19 cases. And the death toll continue going up. And with the public holidays that are upon us now, with Easter coming up, we know that a lot of people travel during Easter. Your church and religious groupings, and we know that in the first wave, a lot of the spread and the COVID-19 spreads were due to some of them were due to church gatherings, and there is a real concern that we might see a huge spike because of that.
Yeah.
And because we don't have a solution as yet in terms of vaccinating a huge number of people. Experts are saying that we're seeing a lot more people dying, and that would have been averted if we had a rollout plan in place.
Yeah. I mean, is it fair to say that it's not the fault of government and that it's the difficulty in procuring the doses that's the issue? Because we will have, if we'd received all of our vaccine doses, we were hoping to have vaccinated 1 million people by the end of this month, which is just a few days away. We're at 182,000 now.
Yeah. I mean, it's a difficult situation that obviously government finds itself in. It has ordered the vaccines, but we haven't had any of them yet. What we are on right now is a trial 3B phase of J&J, and the reason we are on that is simply because we took part as one of the countries that took part globally in its trial phases, and we have been able to have that and benefit from that in order to vaccinate our healthcare workers. But in terms of vaccines that we've procured ourselves, we're really still in line, and it's the difficult thing that countries that aren't as you know, countries that aren't better off.
Yeah.
You know, you have countries that have procured around the globe, but South Africa is definitely not one of those. We are still in line, and we're going to continue being in line. I mean, the deputy president has said that he feels that we are delayed. We're not where we wanted to be. And
but whose fault is that? The fact that we are still so far in line in terms of the vaccines that we've ordered, did we lag behind in ordering the vaccines in the first place?
It doesn't seem as though we lagged behind. I mean, the government had done all it can, it seems like, put aside money in the right times, and we know that we have about 10 billion rands set aside to get those vaccines. And although I must say there are some African countries that already started the rollout plan.
Because technically we haven't started our vaccine rollout plan. As you say, we are part of that clinical trial from Johnson & Johnson. So our vaccination campaign, technically speaking, hasn't started.
Really hasn't kicked off.
Yeah.
And I mean, that was the confusion initially, that maybe the J&J was part of that rollout plan, and that has been clarified that we haven't started that rollout plan. Look, and honestly, Michelle, it does seem as though there could have been more that should have been done. I mean, I remember earlier this year or late last year, there were some complaints by political parties that we weren't seeing the type of haste that we should be expecting in terms of ordering these, or hearing of a plan before the ordering, hearing of a plan long before the ordering of the vaccines. So there may have been some delay, and that's why maybe we're finding ourselves long in the queue for those vaccines.
So let's talk third wave of infections, because we are seeing, I mean, there were a couple of weeks where we saw fewer than 1,000 new infections for some days. Over the past week, I think it's fair to say we've now gone past the 1,000 mark every single day. It does speak to, because we've been here before, haven't we? In the run-up to the second wave of infections, we saw these incremental increases. What are experts telling us now about preparations for a third wave?
You're right. I mean, we have seen this before, and it does feel like deja vu. And you kind of expect that because we've done this more than twice already, there should be proper plans in place. And there are some experts that are calling for a bit stricter measures, especially during this the next 2 or 3 weeks. Given, like I said, the events that are taking place, there should be a bit more stricter regulations around that. But we have also seen that the religious sector has come out in saying that they want more numbers in the religious gatherings and in the establishments. But there is definitely a call from the experts to government for them to be a bit more stricter during this time, given the numbers that are going up. I mean, it's a given. If you're going to continue seeing a lot more people gathering in very small spaces, the third wave is imminent. And it's not only imminent, we are going to be seeing a lot more people dying. And that's the biggest concern, not just the numbers of the infected, but really people are going to be dying because of that.
Yeah. Speaking of religious gatherings, we know that Easter weekend is coming up. It's the time for many churches around the country not only to gather, but to also make a trip to other parts of the country to gather for the Easter weekend. Are those gatherings going ahead as we know them in their previous form, pre-COVID-19?
Well, we understand that they are still going ahead. That's the first and I guess the most important thing, because as you rightly pointed out, that people are going to be traveling outside of the provinces, and we know quite a number of churches draw quite a number of people from across the country. And that in itself, despite the numbers that are going to be gathering in those places, that in itself poses a huge danger in that those cross-border infections that we saw in the first and second wave might be a reality again, given the numbers going up so far. We haven't heard from the major churches as yet whether or not they're going to be continuing with these. I mean, I remember in the first spike or the first wave, there were a number of big churches that communicated beforehand that they would not continue with their gatherings. And one would expect, because we're seeing a third wave on our doorsteps, they would be communicating whether or not they would be gathering. But it's also important to point out again that we've seen quite a number of church leaders coming out in the recent months to say that they want their doors to be open, and not only that, the limitations to be removed. It's a really concerning call, especially given that we're not out of the woods yet, and we might not be out of this for quite a while. And the big thing is that we need to try and make sure that less people die. And with these kind of calls, it's only a matter of time until we see huge numbers of people losing their lives. Yeah,
especially because our vaccination drive is lagging behind. Thanks for coming into studio. Great to have you with us. Hitekani Magwedze is tracking the story for us as we just continue to unpack some of the big developments regarding our vaccine rollout plan, our response to a possible third wave of infections, which experts are telling us is a reality now. 182,000 healthcare workers receiving a Johnson & Johnson vaccine so far, well below that target that government announced some months ago.